We cut through the noise to bring you the insights that really matter. And today, we're tackling something huge. I mean, it's everywhere, right? Weight loss medications like semaglutide, the active stuff in Ozempic, Wegovy, Rybelsus. They seem to offer this, well, a life-altering potential for managing weight. It's pretty remarkable. But alongside the success stories, we know lots of you have questions, concerns even, especially about side effects. So that's our mission for this deep dive. We're going to unpack what you really need to know about semaglutide side effects. What are they? How do you handle them? Can you even maybe prevent them? We're digging into our source material to give you those sort of aha moments, but, without overwhelming you.
Exactly. And what's really fascinating, I think, is seeing how much proactive management can empower people. People actually taking these medications. Understanding the details isn't just passive awareness. It's about being active in your own health journey, making decisions that are truly informed, knowing what might happen and how to respond. Well, that's absolutely crucial.
Okay, so let's start right there. The basics. We hear semaglutide thrown around a lot. What is it exactly? And how does it actually, work for weight loss?
Right. So semaglutide is the core active ingredient in those brand names you mentioned.
Yeah.
OZEMPIC, Wegovy, Rybelsus. Its main job, essentially in weight loss, is mimicking a hormone, a natural hormone your body makes called GLP-1. And this hormone, GLP-1, it helps regulate your appetite, how much food you take in. It also slows down how quickly your stomach empties after you eat. Plus, it boosts that feeling of fullness. So it's not just like killing your hunger. It's more about fundamentally recalibrating how your body handles food signals, which is why it can be so incredibly effective for weight management.
Okay, let's unpack that. So it delivers these amazing results, clearly. But you mentioned side effects. They're pretty common, right?
Yeah.
What kinds of things are we generally talking about? Are they like serious problems or more annoying day-to-day stuff?
Primarily, you're looking at gastrointestinal issues, stomach, gut, that kind of thing. And the good news generally is that they're often temporary. They tend to get better, diminish as your body just gets used to the medication over time. The most common ones people report: nausea, definitely, vomiting sometimes, diarrhea, abdominal pain, constipation, and also that uncomfortable bloating feeling, often from excessive gas. Some people also mention headaches or dizziness, especially as their body's adjusting.
Wow, that's quite a list of GI stuff. Sounds like your digestive system might be having a bit of a rough conversation internally. Not fun. So what does that mean for, how likely you are to get these? Can we predict it at all? Who gets side effects and who skates by?
That's a key point. Everyone's metabolism is different, quite different actually. So predicting exactly who gets what side effect or how bad it'll be, that's really tough. There's no foolproof way. However, the source material we looked at points to a pretty strong link with the dose. Generally, the higher your dose of semaglutide, the higher the chance you might run into these side effects. It's a really big factor in how doctors manage the start of treatment. They usually titrate that dose up very carefully, slowly.
Right. That really highlights that start low, go slow approach, doesn't it? Just ease the body into the change. Makes sense. But okay, beyond those immediate bodily reactions, our sources also talk about something else, a term that's kind of popped up in conversation around rapid weight loss: Ozempic face. This is where it gets really interesting, I think. What is that exactly?
Ah, yes, Ozempic face. That term has definitely gained some traction, hasn't it? What people are referring to is essentially a kind of facial drooping or sagging. See, when someone loses a significant amount of weight very quickly, the layer of fat just under the skin on their face can shrink quite dramatically. And the result is the skin on the face, which used to have that fat providing volume, it can become looser.
Yes.
Sags. This often makes lines and wrinkles seem more obvious, gives maybe a more aged or tired look. But it's really important to understand it's not a direct effect of the drug itself. It's more a consequence of that rapid loss of facial volume that the weight loss causes.
Huh. Okay, that sounds like something people would definitely want to avoid if possible. It's almost like your skin just can't keep up when the weight drops off so fast, yeah? Are there ways to, prevent Ozempic face?
Absolutely. The main strategy that comes up is trying to lose weight at a more gradual pace. More controlled, going slower gives the skin a bit more time to potentially adjust, maybe retract a bit. But, and this is a crucial nuance, significant weight loss, whether it's fast or slow, can lead to loose skin. Excess skin, anywhere in the body really, not just the face. The face is just, very visible, so it gets noticed, gets that catchy name. But loose skin is just a broader possibility with substantial weight loss.
That's a really important distinction. Thanks for clarifying that. Okay, so we've covered common GI stuff, even Ozempic face, but now we really need to talk about the less common things, the potentially more serious health problems that can sometimes happen.
You're right. They are much rarer, but it's absolutely vital people are informed about potential serious side effects. These can include things like pancreatitis. That's a severe inflammation of the pancreas, the organ involved in digestion and blood sugar control. Also, kidney disease, problems where the kidneys aren't filtering waste properly from your blood. Other possibilities include low blood sugar, which can be serious, and even changes in vision. Now, sometimes people might develop these because they already have some underlying health issue that puts them at higher risk. But other times these conditions can pop up even without a known risk factor. And honestly, more research is still needed to fully understand any potential links there, especially when starting semaglutide in those cases.
Okay, and that leads us straight to a really critical safety warning, something the sources really hammer home a major contraindication.
Yes, there is a major one. Everyone thinking about semaglutide must know this. If you have a personal history, or even a family history, of medullary thyroid cancer, that's a specific, often aggressive type of thyroid cancer, or if you have a history of multiple endocrine neoplasia syndrome type 2, which is a rare genetic disorder affecting hormone glands, then you should not take semaglutide, period. Because these specific conditions mean there's a significantly increased risk of thyroid cancer if you take the medication. It's a definite no-go. Your doctor will absolutely screen for this history.
Wow, okay, that's incredibly important. So given these serious, though rare, possibilities, it's critical for you, our listener, to know the warning signs. When do you need to seek urgent medical care? What are the specific symptoms that scream serious side effect?
Right, you need to be really vigilant for a few key things. Red flags, basically. Things like ongoing severe pain in your upper abdomen that could be pancreatitis. Or if you notice you're urinating less than usual, combined with swelling in your legs, ankles, or feet that could signal kidney problems. Any sudden or major changes in your vision. Episodes of fainting or feeling really dizzy. Yellowing of your skin or the whites of your eyes, that's jaundice, another serious sign. All need immediate attention. Other big red flags include a very fast heartbeat that doesn't feel right, feeling confused, or any signs of a severe allergic reaction. Things like a widespread rash, sudden difficulty breathing, or swelling, especially in your face, eyes, mouth, or tongue. If you experience any of those symptoms while on semaglutide, you need to call your doctor right away, or get to an emergency room. Don't wait.
Those are absolutely crucial points. Thank you for laying those out so clearly. Okay, so what does this all mean then for actually preventing side effects, or at least managing them if they do show up? What are the proactive steps someone can actually take? Well, prevention often starts right with the prescription itself. Like we touched on earlier, doctors typically start you on a very low dose of semaglutide, then they gradually increase it, usually step by step over several weeks or even months. This slow ramp up gives your body more time to adjust to the medicine. And that can often prevent those initial GI side effects altogether, or at least make them much less severe. And, if problems do come up, sometimes the doctor might need to readjust the plan, maybe even go back to a lower dose for a bit.
Right, the medical side is key. But what about lifestyle? Diet? Are there practical things you can do, especially for that really common nausea or other gut issues?
Oh, absolutely. There are some very practical dietary and lifestyle tweaks that can make a huge difference, especially for nausea and those general GI complaints.
Our source material had some great, really concrete tips here. What should people try? Yeah, things like eating slowly, really taking your time, and opting for smaller portions at meals. Remember, semaglutide slows down how quickly your stomach empties. So giving your system less work to do at one time and more time to do it, that becomes really important. Food choices matter too. Go for bland, low-fat foods. Think crackers, plain rice, toast. They're just easier on your system when it's, working at this different pace.
Okay, simple stuff. What about liquids?
Definitely. Foods with high water content, like soups, can be helpful. And staying hydrated is key. Stick to clear beverages mostly. Water, of course. Maybe some ginger ale, clear broth, plain tea, or even sports drinks for electrolytes if needed. These help keep things moving smoothly without adding a big digestive load. Helps avoid that really uncomfortable, overly full feeling too.
Makes sense. And what should you actively avoid?
You'll definitely want to steer clear of greasy or fried foods. They just take longer to digest and can really aggravate stomach upset. And here's a simple but effective one. Don't lie down right after you eat. Give yourself some time, maybe 30 minutes, an hour even. Sit upright. Let gravity help your digestion out instead of working against it.
Exactly. And for those minor sort of temporary issues like gas, mild diarrhea, or heartburn, sometimes over-the-counter medications can provide some relief. They can be helpful aids. But it's really worth repeating, for most people, those common GI problems, they usually fade away or get much better within a few weeks. Your body just needs time to adjust.
So consistency and a bit of patience are really key.
That brings us towards the end of our deep dive today. We've covered a lot, haven't we? From understanding semaglutide itself, how it works, to navigating both the common side effects like the GI issues and Ozempic face, and the rarer, serious ones. And importantly, how to potentially prevent and manage them. I think the key takeaways are pretty clear. Semaglutide offers huge benefits for weight loss, no doubt. The common side effects are mostly manageable, often temporary, but the serious ones, you need to be aware, be vigilant, and working proactively with your doctor, taking those lifestyle steps, that's absolutely crucial. So by understanding all these details, we hope you feel better equipped. Whether you're considering this treatment, already on it, or just want to be informed about something that's becoming such a big topic in health. Hopefully this deep dive brought some clarity, maybe some confidence.
Definitely. And maybe it raises one last important question for you, the listener, to think about. How might really understanding the specific ways medication side effects work, how might that empower you? Empower you to ask sharper, more precise questions about any treatment you might consider down the road. Thinking critically about the how and the why behind a medication's effects that can truly transform how you approach all your health decisions in the future.
That's a really powerful thought to leave everyone with. Thank you for joining us for this deep dive into semaglutide side effects. We hope you feel more informed and, yes, empowered